Yeah, yeah. So, sir, the concept is very simple. Every clinic that comes up, whether it is an old clinic or a new clinic, first of all, you need to identify your USPs. From what I can get, I don't know you personally, but what I can get is that your USP is that you have a very vast experience. Having a 22-year experience when it comes to dental practice is a huge deal. Like personally, I have a 4-year experience. I barely know anybody personally who has a 22-year experience. All of my friends, colleagues, they have merely 10 years, 12 years. So 22 years is a lot of experience, and that is one of your main USPs. Apart from the fact that all the specialties, all the specialists that are coming to your clinic, all the patients that are coming to you, all the patients who have gotten good treatment done from you and who have left. So first point is that whenever, first of all, you need to focus on your USPs, which is having a maximum experience. Second, all the clinics that are open in your locality. If you take a round of all the clinics, uh, the size of the clinic is not going to be the same. The interiors are not going to be the same. The skill of the doctors is not going to be the same. The experience of the doctors is not going to be the same. Many of the clinics might be looking like the one on the left side. Few clinics might be the ones looking on the right side. Then all the armamentarium that you're using, the kind of behavior that you have towards your patients, the kind of grooming, the kind of behavior your staff has towards the patients, all of that is going to be completely different. Am I right, sir?
Exactly, exactly. I can understand.
So that is how you differentiate yourself. See, as I said, I showed you the pamphlet in the beginning of the webinar. That one who was doing scaling for 300 rupees. So ideally, if pricing is the main issue with patients, the that clinic would be completely like that. A doctor would become a billionaire within a month. They would get 10, 20, 30 patients for scaling for 200, 300 rupees. But then again, all the patient segregation is also different. That is what we need to identify, that what kind of patients you are catering to. See, somebody who has a clinic on the left side, who has a dirty spittoon, who has some kind of a dental chair which is not even working properly. The kind of people, the kind of patients that will go to that clinic will barely pay 500 rupees for an RCT, or they might not even get an RCT done. They might just go for an extraction. So the kind of patients that are going to that clinic, they are going to be completely different from the kind of patients who are going to the clinic on the right side. The kind of patients that come to you will be completely different from the kind of patients that go to a newly opened clinic who's doing an RCT for just 1,000 rupees. See, in our society, in our population, everybody has a separate income level. Everybody has a separate prestige. Everybody has a separate ego. So all of them, whenever they go to a clinic or whenever they go to pay money to for any dental treatment, they choose clinics separately. They have separate agendas on their minds. Like I was talking to one of my friends a few days back. He was my school friend. He said, I've never gone to any clinic who has done free checkup, because a doctor who does not value his own time cannot value my time and cannot do treatment for me. But there are innumerable number of doctors who are holding free checkup camps in the hopes that patients are going to come to them and they're going to get treatment from them, which they do, because the kind of patients who go there are the different kind of patients. The kind of patients who go to clinics where cost is less, where there are a lot of freebies, where the checkup is free and all that, that is completely different. So I can assure you that the kind of clinic that you have, the kind of patients, the kind of clientele that you have built up in the past 22 years, they are going to be loyal to you. The patients who are not loyal to you, they would have anyway stopped coming to you even if there was no other option of any other clinic.
Exactly, exactly, said doctor. I can understand. Yeah.
So that is a fact. It's just that, see, it gets very upsetting sometimes. Like one of my patients, I remember once came to me for a consultation. They had to get a root canal and a cap. So after that, they did not come back to me, and I assumed they had gotten their dental treatment done from somewhere else, which of course was upsetting to me. But then 1 year later, they came back and they got ceramic braces from them for 50,000 rupees. The RCT was barely 4,000 rupees. So in the end, I ended up getting more money, but they decided to go to a cheaper dentist and not get satisfied from there, and then ended up coming back to me. So that is what I'm trying to tell you, that even if there is a lot of competition, even if there are a lot of patients, even if there are a lot of clinics, and they are doing all sorts of marketing, free camps, free this thing, that thing, everything else, your patients are still going to come to you. A new patient might still come to you, irrespective of the kind of charges that they have, the kind of marketing that they're doing.
Okay,
Plus,
doctor.
of
Well said.
course,
Well said. Yeah.
if you start doing marketing, like as we had a discussion earlier, you said that you have not properly done marketing before this. Most of your patients are coming from word of mouth. So if you start doing marketing, maybe online or offline, something or the other, if you start doing, then the kind of patients who were going to other clinics, they might also end up coming to you. It's all about visibility, sir. Maybe the patients who are going to a new clinic, maybe they did not know any dentist, maybe they just got a pamphlet, they had a dental problem and they decided to go to that clinic the same day. They might not come to you because they don't know about it. So that is matlab, whenever somebody talks about pricing problems or other people giving discounts, I never feel threatened when it happens in my clinic, in my area, because I know either my patients are going to come to me. If they're not coming to me, they were not my patients at all. Yes, sir, I hope I've answered.
Yes, doctor. Your answer was very clear. Thank you.
Thanks a lot, sir. Any other questions, sir? Any other questions from anyone else?
Doctor, regarding Facebook ads and YouTube ads, you told you'll have a course, right? You have
Yes, sir.
a
Yes, sir. For Facebook ads, I already have a course.
okay.
But since you haven't done Facebook as such, I'll send you the link for a free playlist that I have on YouTube. So you can go through those videos. In that, I've talked about how to use Facebook for free, as in how to do the posting and everything. So I think you can go through that once, and then if you like that and if you want to go ahead with the course, I can send you the link for the course as well.
Sure, doctor.